Hi everyone. Thanks so much for tuning in. We are going to give it about a minute or so just to allow more people to sign on, and then we will get started. All right, as some of you know, my name is Julsey Capon, and I am a Lyme literate therapist. And my main office is here in DC, but I work with patients all over the country virtually. Today we're going to really focus on relationships because I truly believe that people who struggle with chronic illness and Lyme disease cannot heal without supportive relationships, supportive caregivers. I just think this is such an important topic, and we're going to let Dr. Jemsek introduce himself, and then we're going to get started on some questions.
Good afternoon. Thanks, Jules. This is the J&J show. I'm thrilled to have Jules here. She's a real talent, and still laughing. So to introduce the topic of relationships, ever since I've been practicing in Lyme borreliosis, we've had from very early on anyway, we've had a set of criteria, which are called poems, which I discussed I think last time, and amongst those are relationships or support. And if a very sick patient comes in, or even moderately ill patient comes in, we say, who's your support? And quite honestly, we can't or shouldn't treat you if you don't have support in a relationship. Somebody that knows what's going on with you every day, and that's somebody that can check in on you. And in fact, if we didn't have that precept, things would turn out in an awful way. It would be a disaster. So that's a fundamental box to check on each and every patient. Now, I showed you some roadblocks before. Now, this is not online, but we have about 25 roadblocks. And we talked about poems last time, babesia last time. We talked about the gallbladder disease and so forth. I'm not going to talk about any others other than toxic relationships or relationships in general, going every which direction, like a web coming from the patient to parents, to siblings, to friends, to church, to spouses, partners, children. I am not an expert in this area, but I do have anecdotal experience with HIV/AIDS in the same sort of situation with chronically ill patients. And of course, I've seen thousands of patients with Lyme borreliosis. So we're going to give it a stab, and I know there are a few hundred of you watching now, and later on there'll be thousands. And later on, we'd like to hear from you as to what you think about the problems that we experience, or our patients experience, in terms of the vital relationships. And there are all kinds of nuances. We'll get into some of those today. But before turning it back to Jules, I just want to say relationships are critical to the essence of who we are, to being relevant, to reassuring us that we have a place in this world, and it's how we learn. And so when relationships are not there, are lacking or break down, it's a critical change for a very ill patient. So with that, I'll turn it back to Jules.
So one of the main questions I get from my patients, or one of the main things we talk about in every session, is how can I get my spouse, my family member, my friends, my siblings to really understand Lyme disease? And so the next few questions I'm going to direct to Dr. Jemsek. So, Dr. J, how do you talk to your patient? What advice do you give to them on how you can truly get their spouse, again, their friends or family, to understand this illness?
We see that a lot, and I saw a lot with HIV/AIDS where for the most part, young males were separated from their parents, their friends, they were shunned. And with this invisible illness, where they've been told by numerous doctors at some point that there's nothing wrong, and their friends say the same thing, and they say, well, what's wrong with you? Why can't you participate? Before we get into that, I just want to go through something I wrote out today to sort of summarize the path that many patients follow. Now, there are many variations on the theme, of course, but this is the path I've seen thousands of times. And the most direct answer to the question that you're asking, Jules, is get the family member in with the patient to come to see us, and we'll talk, and we'll demonstrate the abnormalities that the patient's manifesting, and we'll answer their questions, and we'll have a very succinct discussion that maybe for the first time makes sense. And, you know, we're patient advocates. We're going to stand up for our patient no matter what. I don't want to make anybody cry, but some of you probably will. But I just want to go through this because this is important to understand what happens to patients with this awful disease quite often. And, you know, you can smolder and bob and weave for months or years before you get sick, but at some point there's a critical step down or even a fall off a cliff, and it's all brought on by different stressors or accumulation of stressors. So what are the struggles for our patients? Invariably changes in life, in essential life functions, new stressors. So for example, sleep, pain, psychiatric and fatigue issues that are uncharacteristic. Second, gradual loss of freedom and ability to choose. The world now has new boundaries. Patients become more isolated. They lose control of daily functions that were natural and automatic before. 3, progressive loss of processing function. The inability to comprehend and interact successfully with their environment and their relationships. That's a critical loss, as I mentioned, alluded to earlier. 4, repudiation of an illness by numerous physicians, family, and friends. That's devastating to a patient that is struggling and knows that they're ill. 5, loss of self-esteem. Patient at that point has no support or very little support. They can't function. They don't feel like they're contributing to anything or anyone. 6, loss of self. Just total disorientation. It's who I am, who I used to be. A lot of times when patients are getting better with our care, they say, one of the things that they often say is, oh, I felt like my old self. They remember. And last is loss of the will to live. And I think that's the reason people die, quite honestly. I know it's a non-specific term, but I was asked this question by an interviewer in Ireland a couple of years ago, and she said, well, why do people die? And I didn't give this answer, and I thought about it, and I said, I gave the wrong answer. The answer is they lose the will to live, and that's awful and tragic, but that's what happens. So to answer your question, Jules, get that family member in to talk with us. We can succinctly summarize things, and we can emphasize this patient's not malingering, there are abnormalities, and we can go through a list of things. Okay, do you think this previously active, high-functioning person has a whole list of problems? Boom, 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 and we'll list 15 problems. Do you think they made all this up? Do you think they want to be sick? And we'll be a voice of reason, hopefully, but we'll have to counteract, 10, 20 doctors and many skeptical friends and family members.
Piggybacking off what Dr. Jemsek said about how can I get my spouse or my parents or friends to understand this illness and why are they not understanding it? I think because they have seen 15, 20 doctors before, and the doctors have found no objective findings. MRIs are normal, CTs are normal, blood work is normal. The doctors are saying, there's nothing wrong with you. So parents, siblings, spouses, they believe the doctors. And then they finally, get to Dr. Jemsek or a Lyme literate physician, and then they're told they have Lyme. And it's an invisible illness, and Lyme is one of the most controversial illnesses. A lot of doctors don't believe it. So I think that's a big factor in why spouses, why caregivers do not understand and do not believe in this illness. Would you agree?
I would agree, and I think that the deck's been stacked against the Lyme community. And trust me, I believe there are millions of people in the process of either being incapacitated or on the way to suffering inexplicably. The IDSA has a big stake in denying this illness because they do. Because they can't come out now and say 20 years later, 20 years after they introduced Lyme-Rix vaccine to prevent Lyme, which at that point was hard to get and easy to treat, so why do we need a vaccine, right? They have a big stake, and they still have the bully pulpit. So we're not organized as a medical community, but I'll tell you what, more and more very good physicians are referring to us and trying to treat, but of course don't know the nuances of the illness, and of course we're all still learning. But it's encouraging to see that. The people say, you know, there probably is something about this, something wrong about this, and something actually wrong with the patient. And that's very encouraging, but we have a ways to go, and maybe at the end of the hour I can once again tell you my dream about forming a discipline and creating a college and that sort of thing. That's what we need. It needs to be recognized, and I'm not sure how that's going to happen, quite honestly, in today's political environment and medical political environment. Not sure.
I also want to let you guys know that please ask any questions, and we will be happy to answer them. Another common topic, question that I get often, I'm going to refer this to Dr. Jemsek, is that another big stressor for couples is family planning. So, is it safe to have a baby? You know, what is the percentage of women passing Lyme onto their children? And then if you are pregnant, what is your protocol? Do you stop treating? Do you change your protocol? And then what if you have already passed it on to your child? What do you do then?
So it's common to have many members of the same family involved with this illness. I think we have at least 150 situations like that, if not more. When a spouse is treated here, our treatment programs, whether mostly oral or IV, are typically 12 months, 15 months, dosing 60 to 70 days, or 8 or 9 days a month, doing progressions and so forth, and watching for clinical signs of improvement, physically and reported as increase in energy, mentation, less pain, and so forth and so on. In other words, revitalization. And so pretty typically we can see this happen halfway through, and by 12 months we feel like we've eradicated the bulk of the infections and put the immune system back in charge. At that point, we go into a healing phase. Some healing's already occurred, but we go into a healing phase for, quite honestly, it takes a couple of years, because we're talking about healing the nervous system. And if you're an intravenous patient and have been morbidly affected, just profoundly incapacitated, it's probably 3 years for healing. And that's with a clear path, and that's with doing all the right things. So if you're, for example, a woman who wants to have another child, first of all, you got to get through treatment, and we need at least a year of healing, if not 2. And I was just asked today, one of my patients this morning, is 37, has 2 healthy children, thank goodness. And I told her, I said, well, by the time you're 38 and a half or 39, you probably can see you again. And the program would be, and she already knew the program, so I didn't think it's out there. The program is, as soon as we work with the OB, of course, and we've had 99% cooperation. And we asked the OB in charge, we're going to put our patient on fetus-friendly drugs, so amoxicillin or one of the cephalosporins and zithromax. We're going to do combinations in moderate doses Monday through Friday as soon as we know there's been a conception. And at the end of the pregnancy, I'd ask you to do a DNA analysis on cord blood looking for the spirochete. And we've done this about 200 times. We've had 4 positives. And I think I had one child that had some symptoms, but I haven't heard of any others, quite honestly. So the bigger issue, if you already have a child that's infected, mothers are mothers, and so we treat the child, well, if they allow us to do it, we'll treat the child first, because that's what the mother wants, and then the mother knows that she's going to be treated later. She'll do a lot better in general. This isn't all these cases, but in general she'll do better if she knows that her children are well on the way to recovery.
Another question that ties into what Dr. Jemsek was just talking about is, what patterns do you see in families with multi-generational cases? And do some of the family members who all have Lyme, do some have more severe cases, more severe symptoms than some of the other siblings or parents? And also, do you find that families who all have Lyme, or some of them have Lyme, are more tight-knit, more closer, are closer together than families that only have one person who is infected?
Well, I'll start with the last question first. That's a tough one. It depends on the chaos that is going on in the family in terms of psychosocial disorders and things of that nature. So, and of course with Lyme borreliosis, there's a lot of neuropsychiatric issues, and that can be very disruptive and a big stress, especially if you're chronically ill as a family member as well. So there's no good answer to that, so it varies quite a bit. But I would say certainly with most parents there's a great compassion and understanding, and they're very grateful that they can access care, because it's been so frustrating, not to be able to do so. Multi-generational questions, it's interesting because when you do a good history and physical, you go back at least, one generation, you go back 2 generations. What did grandfather die? What did grandma die? What did great aunt, or great uncle? You'd be amazed how many had some sort of undefined neurologic illness, early dementia, rheumatoid arthritis, and died at relatively young ages, and it's passed down through the generations. So I think this illness has been around for a very long time. I've always been knowing what I know about the spirochete and how easy it is for it to navigate through the human body. I've always felt that the vertical spread of this infection is very high, and yet not proven, not even studied. I think the CDC is afraid to study this. They don't want the answer.
Mm-hmm. We're going to shift a little bit and talk about friendships. Again, that's a common stressor too, because everyone needs some social support. So we're going to start with one question that I received, which is, how do you explain to your friends that it's not that you don't want to hang out with them, it's just that you're too sick and you know that you can't keep up with some of the things that you do? My answer first would be, you have to have open conversations with them. You have to explain that you have been sick for however long, 1 year, 2 years, 3 years, and that if you do go hang out with them, for instance, go on a walk, a hike, go see a movie, go to dinner, that might set you back 3 days or 4 days, or it might, put you in a big episode or a relapse. And a lot of people don't understand that. They just think, okay, you're sick. A lot of people get sick. It's easy. Just come on, go to dinner. It's not easy. It takes a lot of energy. So you have to explain that to them. And then also explaining to them that you might have to cancel last minute. And when you do that over and over again, friends start to think that, okay, they just don't want to hang out with me. And then they stop inviting you because they just expect that you're not going to show up, But you have to continue to connect with them. So even if that means calling them once a week, FaceTiming with them, asking them to come over to watch a movie, things that you can handle that won't, make your symptoms worse. But showing them, telling them that you still care, but you have to do what your body can handle. And if they're good friends, they will understand that. And some friends just don't, and, they're not, I personally think they're not good friends. Another question relating to friends is, well, actually, I just answered that, is how do you maintain friendships while you're sick? So that ties into what I just talked about. And then another question I got I isolate myself and don't communicate with my family and friends because they're tired of hearing about my health. They're tired of hearing about my illness, and then I don't want to bother them. I don't want to burden them, and it irritates people. And I get that. I've had Lyme disease for 3 years. It was horrible. Dr. Jemsek treated me. He gave me my life back. I'm pretty much in remission. I had to say that, so you're my hero. But, first of all, you have to have open communication with your caregivers and tell them that you feel like a burden. You have to have that conversation with them and say, I need someone to talk to. I feel lonely. So do you mind if you're the person that I, talk to about how I'm feeling? They will most likely say, please, I want to be there for you. Never, ever feel like you're a burden because they care about you. But it's that guilt factor that we feel of we're bothering them. But being upfront with them, telling them how you feel, which I know is hard. A lot of people don't have those communication skills. You have to work on it because that guilt will eat you alive. So that is my advice for maintaining relationships and working on communication. All right, let's move on to the next question for Dr. Jemsek, which is, we've kind of already talked about this, but we'll see if he has anything else to say. What struggles do you see spouses having the most when one of them has Lyme and the other does not, such as compassion fatigue?
Yeah, thanks for your answers, Jules. So this gets to the grist of it. First of all, for the people that have Lyme, Jules pointed out to me that in her forums she hears that so many people feel guilty, and I'm in favor of creating a guilt-free zone where you can go, and also the activities should be light, but they should be companionship and dialogue. I've already mentioned relationships are critical to maintain the essence of who we are. And if you don't have that and you isolate, which is typical for this illness as I went through, you become more and more distant. And as you physically and mentally deteriorate, it becomes harder and harder to get back. You can't do this alone. You have to have the support. Now, in relationships where there's one caregiver, we've had some interesting conversations, and I think there is such a thing. So you have a caregiver, and it depends on what's going on with the caregiver. The caregiver is all of a sudden faced with months, if not years, probably years, of having to devote care to the medically dependent person. And it's with the caregiver's life in so many ways. Now, the best relationship is an honest relationship where there's true love, and the caregiver has resilience and has a life of their own, so that they can be productive. Maybe not, but they can be productive. If it's all about getting gratification from caring for the medically dependent, then we get into a codependent situation, which is unhealthy. And some interesting things can happen as the medically dependent person gets better, and the caregiver loses that reward, if you will. And then we have, and I've seen this many times, and again, with HIV/AIDS, I saw our young men abandoned by their parents, their siblings, and, they had usually a devoted partner. And this was, a long time ago, but, our clinic became their best friend next to their partner. And, we were all about hugs. So we had lots and lots of hugs every day. Because, we didn't know if we were going to see them again, quite honestly, some of them. And we'll get to COVID later, but I think the same thing's going on with the social distancing. And quite honestly, that human relationship and touch is so important. I'm all for hugs for health. Hugs for health. and unmask us, or at least just be sensible about it. But in the relationships, and Jules can expand on this, if we have a person who has a touch of narcissism, for their whole life, they've wanted to, the more compliments they get, the more people applaud them, they need that, right? Because they're a narcissist. And it could be a mild situation, it could be severe or disabling. But the narcissist is all about themselves, and the reason they're doing this, in this case, is to get the plaudits from people around the two of them, around a medically dependent person. So they're getting praise all the time. Oh, you're doing a good job for Johnny, a good job for Dora, et cetera, and just we're really proud of you. All the time this caregiver is unhappy because it takes away from their self-fulfilling activities. And I've seen this before and it shocked me. And then when the medically dependent patient gets better, that caregiver is usually hasta la vista, they're out of here. Like, the hell with you, I'm tired, I had to give all this stuff up, and I've seen this happen. Now, if they have a little sociopathic, I'm not trying to be a psychiatrist here, but they have a little sociopathic bent, they're such good liars. Oh my God. I've gotten fooled several times. It really makes me upset because I can't, I just keep getting fooled. I guess I'm just gullible. But they're such good liars. They're fantastic. Of course, the patient who's getting verbally abused and sometimes beaten doesn't say anything. And the sociopath narcissist will come in and say, oh my God, I can't wait till you write your book, and we're so happy what you're doing, and she's getting so much better. And oh my God, this is great, and they're lying the whole time. And so anyway, you have a whole spectrum. It's a fascinating subject, quite honestly. And there's not a lot out there there's a lot on codependency and dependent situations, narcissism and all that. But as far as the chronically medically ill, we've had the HIV epidemic where that was certainly the case, different paradigm. Now we have another situation where literally millions of people need support, but they're up against the dialogue of and the interviews with 5 to 15 or more doctors, and therefore it's hard to go over that. And so I really respect my patients. I'll tell you why. I talked about losing the will to live and loss of self-esteem and loss of self. My patients may have wonderful support. Now, how they can get there one of two ways. They have wonderful support. We have a devoted, loved one who really cares about them and who is resilient and has their own life. And or our patients somehow have the embers going in their soul that says, I want to keep going, I'm not ready to die, and I think there's something wrong with me, let's keep going. And when they get to us like that, I just have so much respect for those individuals who have this strength, even though it's waning, to come in for treatment. And realistically, we'll give them hope if it's there, and we'll be perfectly honest with what we think we can do, or we may say wait and see, but we do make sense to them, hopefully, and I respect those individuals very much. So we've talked briefly about a very complex subject, and I love your input on this, about the complex dynamics in a partner situation, and the whole spectrum of relationships that can occur and do occur. And in just a moment, I want to talk about how do we take care of the provider. Who's thinking about the provider? What do they do? I know they need to be resilient and have their own life, but there is such a thing as compassion fatigue, and how do we take care of the provider? And I don't know, Jules, do you have any thoughts about that?
Well, compassion fatigue exists. It's real. Going on, my personal experience, I know my husband felt that tremendously. As I said, I was really sick. I was, debilitatingly sick. And my husband just, it took over his whole life. And so, and I was engaged. We weren't married yet. So I knew that if this continued, like if he didn't get a break, he would just burn out. So what I did was I just stayed at my parents for a little bit, gave him a break. So multiple caregivers can be really helpful. I kind of look at it, well, first of all, compassion fatigue is normal. Absolutely normal. It would be kind of weird if someone didn't have compassion fatigue at some point, if they were always taking care of someone. So, if the healthy partner feels that way, don't feel guilty. But how I look at it, and this is kind of like a very simple comparison, but let's just say a mom, for instance, has 3 or 4 kids. I mean, that's exhausting. And they're taking care of little kids. And I've heard so many moms say, I need a break. I can't do this. This is exhausting. Grandparent, please take them for a weekend. Or, their aunt, please babysit them. Everyone burns out. And so I think the best way to help the caregiver is just some time away. What do you think? Do you?
No, I totally agree. I totally agree because it is exhausting. And to your example of how about a mother of 3 who has 3 healthy children and 1 sick child? Mm-hmm. Who gets all the attention?
Yes, very true.
So, tough situation, but I think time away, and better yet, multiple caregivers, if possible. So when we interview our patients, and particularly if we see they're quite ill, who's your caregiver? Well, I have a neighbor. Okay, that's a C minus. Who else? In the church or family? No, not really. So we really try to recruit more than one person. And, we tell the patient, okay, you're very lucky because, you can't do this by yourself. You need some care. We need to have people know what's going on. You're going to get better if you have support and you're able to follow our program and, God willing. So we're always looking for that. It's so important. And again, the whole thing about relationships and dialogue, that's how you learn. That's how you fulfill the essence of your existence and keep it afloat, if you will. It's just a critical thing because remember, our patients are losing life functions, or they're struggling, they're in pain, they're disoriented, and it's a horrible existence. They start losing everything and they lose control. So I've noticed, and speaking of control, just off topic a little bit, I've noticed one thing about our Lyme population is that, oh my God, they want to control anything. So they feel a little bit better and say, well, that was my idea. I get credit for that. And they just want to control something. And I get that, but it's kind of I think everybody needs to understand this is what is happening in terms of the psychodynamics, if you will. And you can't blame them. On the one hand, sometimes it gets pretty obnoxious, however. But it is really what's happening. So, the whole family thing is tough.
One last comment on what Dr. J was talking about is I remember my first intake here, and they were asking about my support system, and they were very clear that they will not treat me unless I have a very secure support system that is close to home, close to you, that can be there to, support you, that can just run over quickly to your house if they need you. If you're doing IV therapy, especially, for instance, that you need someone right there with you. And I just thought that was really unique for a practice, that they're not just going to treat anyone because they care. And they believe that supportive relationships is crucial to healing. that's why we're doing this live stream, a whole live stream on relationships, because healing will be delayed without support. I also just want to stop and say that we're so honored to have this discussion with you, and thank you so much for watching. I know this can be, a very sensitive topic, and we just really appreciate it. Speaking of a sensitive topic, I want to shift a little bit and talk about lack of intimacy with your partner. It's another big stressor. I'm going to direct that to Dr. Jemsek, because there are some scientific reasons why that can happen.
Well, it's very common for obviously the pituitary, hypothalamus, pituitary is a high vascular area, and we have infections streaming and seeding neurons everywhere in the central nervous system, but really the limbic system very hard, affecting mood, memory, appetite, sleep patterns, and then there's all sorts of hormonal issues that happen because the anterior and posterior pituitary are inflamed and not producing the hormones they need to activate the hormone glands downstream. So part of that is the LH, or luteinizing factor, and FSH, follicular stimulating hormone, which both men and women have, which stimulates in the male the Leydig cell and the Seminole cell, I think it is. But and when that's affected, you are not making your testosterone as a male, and that lowers your libido significantly. There may be pelvic problems, sacral problems with innervation of the pelvis and genitalia, where the voltage to those particular areas is underserved. The same thing can happen in women. Or there's pain issues, which is particularly common, or more common, I guess, in women, but probably not really. But since that's called sacral plexitis, and you can get pudendal pain, and you can get psoas pain, and you get pelvic floor laxity and inflammation and spasm. It's very painful. So we have discomfort issues. We have reduced libido, reduced hormones in both. And women, it is important to have the testosterone. Testosterone is something we think is very important. We'll try to use some testosterone if it's low, because it helps with the energy, the body cell mass, the muscle growth, bone health, although estrogen is more important, but it also helps with brain health. So, but this is just one of many moving parts in the illness. And we encourage our patients to be intimate, but if you have an infected patient, we really need to use barrier contraception, because we don't want to making the assumption that the healthy partner is shedding the spirochete, which I'm convinced everyone does. I call this a guilt-free STD. I just know this spirochete just wiggles wherever wants to go. So anyway, barrier contraception. And so, all right, hormone, pain issues, libido issues, of course, and so.
I also think that couples struggle a lot with this, because when the person who is sick and has Lyme disease, and they don't want to be intimate because of the reasons Dr. J just mentioned, that the healthy spouse takes it as, you don't love him anymore, you don't find him attractive, you're just not interested in it anymore, and your partner can feel very sad about that or defeated. And it's really important to communicate. Again, it all comes down to communication, that you have to say, it's not about you, it's not that I don't want to be intimate with you, it's that it's the illness, and I'm already in so much pain from all the other symptoms, and this is just one more thing that hurts, and I usually don't have the energy for it. And so just having that open communication with him, or her, sorry, is really, really important. All right, so next question is, how can you be the best partner while you are struggling with this illness? But a lot of advice for this question. Okay, I know that I've said this word a lot, but communicate. So I'm going to give some. Number one, you have to tell your partner what you need. You have to have the confidence to tell them, I need you to do X, Y, and Z. So, for instance, when I am talking to you, I just need you to listen. I don't need advice. I don't need criticism. Just listen. Give me a hug. Or if you do want to have a conversation about your marriage, about your relationship, say we need to come up with some solutions. We need to really sit down and come up with ways that we can work on this, whether that's doing it by yourself or couples counseling or support groups. But, going back to my own experience, it was really hard for me to communicate with my husband what I needed. And I needed him to just listen and be there for me, not offer me advice, and just, give me hugs. And another thing that really helped me and really, has helped a lot of other people is having kind of just a code word for that means I'm not feeling well, I can't do anything today. So whether that's, a code word of not today or, bad day. And that just means, sorry, not a good day, can't go to lunch, because that kind of lets them know that today, is not happening. Instead of your partner coming home and expecting, that you guys are going to go to dinner or whatever. So before, just letting them know. So there's really just no, expectations, or you're not letting them down. That has really helped me and a lot of people. Another thing is to tell your partner that, you need words of encouragement, because you're feeling most likely down. You're feeling like you have no self-worth. You might feel that you're unmotivated. You might even feel that you're lazy. So just asking him or her, sorry, I keep saying him because I'm married to a man, asking her or him, I need you to tell me everything's going to be okay. I need you to tell me I'm strong, that I can fight this, that I'm resilient. Because the person who's sick needs their self-worth to come from someone else. Your self-worth, your identity will come back when you're, in the process of healing or healed. But your partner, your caregiver really needs to build you up. And another thing that people say is, I've lost my identity. So they, say, I'm Lyme. My whole life is Lyme. That's their identity. And you're not Lyme. Lyme is what you're going through. It's not what you are. And so how can you start having an identity that is not an illness? And I get it. Your whole life is doctor's appointments, treatments, maybe surgeries. How can you not think, it's your only thing? But you got to really focus on what else you have going on in your life. And a lot of people say, well, I can't do anything. I can't do the stuff I used to do. Okay, well, find some other things. Can you draw? Can you do yoga on the floor? Can you knit, from your bed? I mean, anything that your body can handle. And that takes motivation. But, you've got to start having other things in your life besides Lyme. And I think that was my main points.
Thank you. Yeah, that's wonderful. Thank you. So this disease is just nasty, right? So we like hugs. We hugs for health, but guess what? A portion of our population is sensitive to touch because of the neurologic changes. That's called central or regional pain. CRPS is the regional pain. Don't touch me pain, we call it. And paradoxically, if you give somebody a real strong squeeze, you activate different nerve fibers, which are not quite as inflamed. But if you do a light touch, it's very painful to them. So some of you out there understand this or probably have experienced this. And we have different types of pain with Lyme borreliosis, and none of them they all require different approaches and treatment. And so the hugs will have to be replaced by kind words and words of encouragement. And, honest communication with that caregiver who's doing things for the right reason and has made a commitment, and not the covert narcissist that I spoke of earlier. And speaking of relations, I thought as we were preparing for this that, that's what makes, our practice enjoyable and productive, I think, is that we do try to develop relationships. We have a proper professional and patient separation, but we spend a lot of time with our patients. We like to learn about their families. And I think that is good for the patient, but it's also good for us and good for me. And I thought, well, the same thing applies to you, Jemsek. It's, you're going through the same thing, and that's why you've been blessed to have some success. And I think that's a huge reason why. For example, we're very careful about crafting our chart work and our office visit notes so that we can follow our patient without getting totally lost, because there's so many things going on. So we put a lot of effort into that, and that helps immensely. And then when we do an examination, so years ago, one of the felons in the IDSA, who's been against this, but who has 15 patents in the Lyme world, said, well, there's no objective findings in this disease. And he would be right. He's found no objective findings. And he hasn't found any objective findings because he's never examined the patient. He's never touched the patient. Now, I think Jules will confirm this, that you've been to a bunch of doctors. And sometimes you would go in and they would look at you and say, I don't think that's true, and they don't even touch you, right?
Yes, before coming to this practice, I have been to so many doctors, and I explain my symptoms, and they look at my MRIs, and they look at my blood work, and everything's normal, and they do not do any physical exam. So they don't test my reflexes, they don't, what are all those things called? Like a neurological exam where they see if you can touch your nose and walk in a straight line. Like, how can you not do that? So I just thought when I came here, first it was like a 3-hour appointment, and I was like, this is different. This is wonderful. And I remember when I was finishing up my IV treatment, I think, 9 months or 11 months, I forget, of IV treatment. My mom always came with me to every appointment, and when I was finishing up, she was actually sad I was finishing up because she had formed such a close relationship with Dr. J and Sarah, who was the IV nurse. Because that's what this practice does, is they care. And they, like Dr. Jemsek said, they want to find out about your family. We were laughing so hard that she was sad that I was done, which really she should be happy. But she was like, I'm going to miss this place so much. But I just think, again, that shows how, how great this practice is.
That's so funny.
One thing I forgot to say, going back to, I know we don't have that much time left, but how you can be a good partner and, help your relationship is doing little things like having dinner dates in your house or in your bed, bringing dinner in your bed, or laying by the fireplace, watching, a movie, setting up like pillows on the ground and watching a movie together, not just like normal things like, people probably just watch TV together, like just doing unique things that doesn't take a lot of energy and it doesn't require you leaving the house, and it provides like a little bit of excitement. I just forgot to add that.
I'd like to say, as we wind up today, again, thank you for listening and sharing, and we hope this has been helpful. Hope to do another live stream before the end of the year, and then we'll see how it goes next year, but hopefully try to stay on a month schedule. Won't be able to work with Jules until sometime in the spring, so the J&J show will have to wait for a while. She has other obligations. But I want to say something about COVID. What a contrast. And we have this epidemic, pandemic, and everybody's, the news is totally occupied by it. And yet we have an equally ugly, but different pandemic and chronic illness that is devastating lives and has done so for decades, a couple decades at least, if not more. And my strong conviction is that COVID, the natural course of the illness is not known yet, really. But guess what? I'm sure it's one of the triggers that, they're non-specific triggers. Sometimes they're infections, sometimes there's car accidents, sometimes it's postpartum, sometimes it's a series of emotional setbacks that flip a fragile immune system from having some control over the borreliosis complex stealth pathogens, such that the spirochete and the others are free to go and infect and create all sorts of chaos, where the immune system now is playing catch up. Same thing happens in COVID if it gets bad. Immune system playing catch up, causing that inflammatory storm, causing us to have microthrombi and some of us dying. And as we age, our natural immune systems, the innate and adaptive system, wanes significantly in the elderly, and that's the reason they're at high risk. But having said that, I think COVID flips a lot of people. And so as we look at people, well, COVID caused, ongoing dementia 3 years from now, and it must, it affected the brain. Well, yes, it did affect the brain, but is COVID the answer, or is it responsible? Just something to think about. Unfortunately, the Lyme epidemic is not recognized by the mainstream, and it's quite the paradox in my view. And just want you to think about that. And stay safe. Don't get COVID. It won't. It'll set you back. And I've had, actually in my own practice, I've had several examples of people that got COVID that were on the way to healing that got set back a few months. So it's all about keeping the immune system ahead of the pathogenic surges. Mm-hmm. Yeah, so.
One really quick comment about COVID is that a lot of my patients have actually said that this, pandemic has helped them in a way of not feeling guilty, of, not being able to go out, not being able to do, some of the social activities. They feel like they don't have to make up excuses anymore because no one's going out anymore, really. I mean, everyone's, isolating themselves. So in a way, people are feeling better because they can just stay in their cocoon in their bed and, guilt-free. However, I know there's a lot of people who COVID is affecting them negatively because, they can't go out. If socializing was something that was keeping them, healthy, or is the one thing that they could do, then, it can set them back. So, positives and negatives.
That's an excellent point. You made, quite a number of excellent points. So I want to thank Jules for working with me, putting up with me, and bring her expertise to the table. She does a wonderful job, very smart young lady, and very good heart, and such a hard worker. In fact, I think you overdo it sometimes, but this has been a wonderful topic. I promise we'll revisit it sometime in the next few months. I'd love to get some of your input and criticisms and insights so that we can help further the discussion in this very important area. Thank you very much.
Yes, please, please, please send questions, comments. We want to hear from you. We will definitely revisit this topic again because it's just so important. And I thank you all for watching, and I'll see you next time.